Hello student, welcome to learnclassic.education. Today we are going to read about breast disorder. It is one of the most important topic in BSc nursing. Okay? So coming to the introduction part. Breast disorder include both benign and malignant conditions. So they can affect women of all age group. Remember one thing, they can affect the women of all age group. So common symptoms include pain, lump, nipple, discharge. So these are the common symptoms. And how you can see the symptoms? You can palpate the breast from center to the axilla in a circular manner. Okay. So the common symptoms include pain, lump or nipple discharge. Now early detection and treatment improves the outcome. So you know that early detection and treatment can improve the outcome. So awareness and regular screening are essential for breast health, and nurses play a key role in early detection, education and support. So coming to the anatomy of the breast, it includes lobes and lobules, then milk ducts, fatty tissue, blood supply and lymphatic drainage and auxiliary lymph nodes. So these are the common structures of the anatomy of the breast. You can see a proper breast image in the Google. So it would be better to locate all these structures and then it get imprint in your mind. So these are the common structure, that is lobes and lobules, milk ducts, fatty tissue, blood supply and lymphatic drainage and auxiliary lymph nodes. Coming to the common benign breast disorders. So these are the common benign breast disorders. So first is fibroadenoma, then coming the fibrocystic breast changes, breast cyst, intraductal papilloma and fat necrosis. These are the common breast disorder. Okay. Now coming to the classification of the breast disorder. Classification of the breast disorder include benign breast disorder, inflammatory disorder, infectious disorder, congenital abnormalities and malignant disorder. So these are the classification of the breast disorder. I will repeat once again: benign breast disorder, inflammatory disorder, infectious disorder, congenital abnormalities and malignant disorder. So malignant disorder comes under the breast cancer. So it is like the breast cancer. So these are the classifications of the breast disorders. Now breast cancer, the breast cancers, the important part is to read is the definition, risk factors, warning signs, types of breast cancer and importance of screening. So these are the important topic which you need to focus on in breast cancer, that is definition, risk factors, warning signs, type of breast cancer and then importance of early screening and detection, so that it helps in preventing the complications. Now signs and symptoms include, as explained, breast lump, breast pain, that is mastalgia, then nipple discharge, skin dimpling, nipple retraction, swelling of the lymph nodes. And how you can detect this sign and symptom? You have to palpate and access the breast from center to periphery. From center to axilla, you have to palpate in a circular manner. So through that you can detect the signs and symptoms, especially the breast lump. Then treatment option. What are the treatment option? It includes surgical treatments, radiation therapy, chemotherapy, hormone therapy and targeted therapy and immunotherapy. So these are the treatment options for breast disorders. Now diagnosis and detection. So diagnosis and detection include clinical breast exam, imaging techniques, that is mammography, ultrasound and MRI, biopsy and pathology, self-examination and awareness, then early detection improves survival rate. So these are the diagnosis and detection, like how you will detect the breast disorder. So first you have to do, that is early breast exam. Early breast examination is important. Then imagining techniques like mammography and ultrasound and MRI. Through this we can see the breast lumps or other signs and symptoms. Then biopsy and pathology, self-examination, we can give health education to the patient, like how to do the breast examination and ask them do a self-examination, or you can do by yourself and spread awarenesses among the patient. Then early detection improves survival rate. Coming to the prevention and conclusion, so it helps in maintaining a healthy lifestyle, regular screening and self-exams, early detection saves lives, seek emotional and psychological support, stay informed and spread awarenesses. Together we can fight breast cancer. So as it is, these are already have explained. So these are some important part like how to prevent. So nursing management. So first and the foremost thing we have to do is give health assessment and risk assessment. Then give the patient education and health promotion, support during diagnostic procedures and treatments, pain management and symptom relief. Then emotional and psychological support. We have to give emotional and psychological support all the time in every cases because it is very important. Then monitor for treatment side effects and complications. Encourage self-care and healthy lifestyle. Self-care and healthy lifestyle is very important to prevent like complications, and also it prevent the any kind of disorders. Then and early, as already explained, early detection and the prevention will help preventing the complications. Then coordinate care with interdisciplinary team. Like in hospital we have to do a teamwork, we have to coordinate the care together, and like with the AMOs, with the senior staffs, and if pharmacy, and everyone should work together for the treatment of the disorder. Then maintain accurate documentation and follow-up, promote adherence to treatment and follow-up appointments. So that's all for today's breast lessons about breast disorder. Thank you.